Stem cell therapy involves the use of stem cells to treat or prevent a disease or condition. Stem cells are unique in that they can develop into many different cell types in the body, making them a powerful tool in regenerative medicine. The therapy typically uses two main types of stem cells, embryonic stem cells and adult stem cells, including induced pluripotent stem cells or iPSCs. How does it work for medicinal purposes? Stem cell therapy works by replacing damaged or diseased cells with healthy ones. Stem cells can differentiate into specific cell types needed to repair tissues, organs, and other parts of the body. They also release growth factors and other molecules that promote healing and reduce inflammation. What are the active ingredients that are important for its medicinal properties? The primary active ingredients in stem cell therapy are the stem cells themselves, which include embryonic stem cells, or ESCs, derived from early-stage embryos and can differentiate into any cell type. Adult stem cells, found in tissues like bone marrow and fat, and can generate replacements for cells lost to injury or disease. And lastly, induced pluripotent stem cells, or iPSCs, which are adult cells reprogrammed to an embryonic stem cell-like state. What forms does it come in? Intravenous infusions, injections directly into tissues such as joints and muscles, topical applications for skin and wound healing, and surgical implantation. What if I have an imbalance or deficiency? Well, stem cell therapy is not typically used to address nutrient deficiencies. Instead, it is aimed at treating severe injuries, degenerative diseases, and conditions where significant cellular repair or regeneration is needed. When was it first used for medicinal purposes? The first significant use of stem cell therapy was in the 1960s with bone marrow transplants for leukemia patients. Since then, the field has expanded significantly, especially with the advent of induced pluripotent stem cells or iPSCs in the early 2000s. Which conditions and symptoms does it help? Stem cell therapy has been shown in studies and clinical trials to help with the following conditions and symptoms: blood disorders. It treats conditions like leukemia, lymphoma, and sickle cell anemia through bone marrow transplants. Degenerative diseases. It addresses diseases like Parkinson's, Alzheimer's, and multiple sclerosis by regenerating neural tissues. Orthopedic conditions. It promotes healing in osteoarthritis, cartilage injuries, and tendon damage. Cardiovascular diseases. It repairs heart tissue post-myocardial infarction or heart attack. Autoimmune diseases. It modulates the immune response in conditions like lupus and rheumatoid arthritis. And finally, wound healing. It accelerates the repair of skin injuries and ulcers. To promote your overall wellness and for a world of evidence-based natural treatments and supplements at your fingertips, please download and subscribe to the HealisticMD mobile app by using the link in the description. Nature's got your back. Which conditions and symptoms does it help prevent? Stem cell therapy can help prevent chronic degeneration. It prevents the progression of diseases like osteoarthritis by regenerating cartilage. It also helps prevent organ failure by repairing damaged tissues, for example, heart failure. Additionally, it can prevent complications of severe blood disorders by replenishing healthy blood cells. Which foods are rich in it? Well, stem cells are not found in foods. They are obtained from specific medical procedures or laboratories. What are possible side effects? Stem cell therapy is generally safe when administered by qualified professionals, but possible side effects include common, which occurs in 10 to 30% of cases, pain at the injection site, mild fever. Less common, seen in 1 to 10% of cases, infection immune reactions such as rejection or graft versus host disease. Rare, affecting less than 1% tumor formation in cases where cells differentiate improperly. Severe allergic reactions. What's the recommended daily dose? Well, there is no standard daily dose for stem cell therapy as it is tailored to the individual patient's condition and treatment plan. How many days does it take to work? The effects of stem cell therapy can vary widely. Some patients may notice improvements within weeks, while others may take months to see significant benefits. The time frame really depends on the condition being treated and the patient's response to therapy. What time of day is best to take it? Stem cell therapy is typically administered based on a treatment schedule determined by a healthcare provider. The time of day is generally not a critical factor. Is it best to take it with or without food? Stem cell therapy administration is not related to food intake.